And for the next session, may I please call on our moderator, Dr. Wasista Budiwaluyo, Vice Chairman, International Relations Institution of the Indonesian Hospital Association.
Good morning, distinguished guests, ladies and gentlemen. We are now in the fifth plenary session of the second day of HMA 2016. I inform you that the time is up now. Yeah, it's 10:45, but I get permission from Mr. Ireland that we can continue for another 30 minutes. It's okay? Okay, this plenary session will mention urgent health challenges and fast emerging digital technologies are prompting a global rethink on how healthcare is organized and delivered. Health leaders recognize the need for a more integrated approach to care that maximizes efficiency, improves patient experience, and ultimately fosters a healthier population. Meeting this emerging challenge will require a new approach to healthcare. I would like to invite Mr. Johan Vooren, the General Manager, Southeast Asia, Philips Healthcare Asia Pacific, to be on stage. He will give a presentation on the second day as a creating meaningful, innovative for future healthcare systems. Johan Vooren assumed the role of General Manager, Southeast Asia, Philips Healthcare Asia Pacific from 1 September 2014. In his current role, he is responsible for the revenue and profitable growth of the Asian region covering 10 markets. In his career spanning 20 years, he has held many different positions and brings with him global sales experience across 3 continents, Europe, Africa, and Asia Pacific for both emerging and mature markets. Johan was Vice President for Imaging Systems, Asia Pacific from 2011, before being appointed into his current role. Okay, Johan, your time is 20 minutes. Thank you.
Thank you, Dr. Wasista. Madam Minister, Prof. Quay, distinguished guest, Philips is very proud to be here today and very proud also to be the platinum sponsor of this 15th HMA event. Of course, I'm extremely honored to speak to so many of our customers here today, so many colleagues and peers, and so many friends. Did you know that our global population will actually grow to 9 billion people by the year 2050? 80% of the world's elderly population by that time will actually live in Asia Pacific. More than 25% of over 40-year-old people by that time will at least have one non-communicable disease. So the question is, what can we do to help the industry, and what do we need to pay attention to? And at Philips, we strive to make the world a more healthier and more sustainable place through innovation, obviously. And our global mission is to improve the life of 3 billion people a year by 2025. And that is a very bold vision, I do agree. But looking at the state of the world is in today, and just thinking of some of the facts I've just mentioned, we believe at Philips it is a path worth taking. So with our global understanding of these emerging challenges, we see major opportunities to apply our innovation and create value for all our stakeholders, especially here in Asia. And Southeast Asia is, as we know, a mix of many countries with a population larger of that of Europe, but it's a very exciting region to be in, and it's a very promising region to be in. We see growing economies across Southeast Asia with an average growth of 5% per year over the next few years. Vietnam is leading this year, I think, with 9.6% GDP growth or something. So fast economies in Southeast Asia. Also favorable demographics. It's a huge middle class, and also the middle class is growing and doubling over the next 2 decades. It's also an extremely young population. 50% of the population in Southeast Asia is below 25 years old. So it's a very promising region. It's also a region where we see stages of healthcare development differ significantly across. On one hand, we see a gap in healthcare expertise, and we talked about it a lot in this event already, in both medical specialists, but also in hospital management, as been referred also by Ministry of Health earlier yesterday. And for instance, in Myanmar, but also in Vietnam, where we see that we really need more education in programs on both equipment, but also in developing new business models. On the other side of the spectrum in South Asia, we see, for instance, in Singapore, where we see the government is really funding the Singapore healthcare system with a clear focus on driving innovation and improve overall system efficiency and effectiveness. Again, and also this has been already repeated many times also this morning, but aging population is really one of the key challenges. Asia Pacific is home of 50% of the world's elderly population. And the number of older persons in this region is expecting to triple from 463 million to a staggering 1.26 billion by the year 2050. And for instance, in Vietnam, we also see this amount of elderly population growing very fast. Today, the elderly population above 6 years old in Vietnam is around 6 or 9 million, I think, and that will triple to around 32 million by the year 2050, which by that time is then 30% of the total population. Other key challenges we see is qualified staff. Do we have the right capability? I think we have the capacity. There's enough people, but are they capable and are they also competent to work in the healthcare domain? Not only in management, but in all many different areas. Clinical application, biomedical engineers, normal engineers, nurses, doctors, what have you. Especially in Vietnam, the density of physicians on a population of 1,000 people is only around 1.2, which really needs to improve over the decades to come. High presence of non-communicable diseases, which is also adding an extra burden on the already stretched system. And in Vietnam, typically, non-communicable diseases are the leading cause of death. Stroke with 25%, heart failure with 8%, and these are just some key indicators where we see that this non-communicable diseases is really an emerging trend as well. So how can Philips then make the difference in health technology? Well, we are a health technology company, and we would like to improve people's health and enable better outcome across what we call health continuum. We heard that health continuum phrase earlier today as well. And we would like to look at a holistic view on the health continuum. And we believe it starts with healthy living. Prevention also will take a key role. Of course, diagnosis, a topic where Philips historically is very strong in. Treatment, and then eventually into home healthcare. And we see a couple of trends which really shape health technology going forward. Consumers are increasingly engaged in their health, and they would like to create much more opportunities to really focus on prevention. As mentioned, global resource constraints, that will really need to drive health systems to a more value-based healthcare. Reducing cost, increase access, and improve outcomes are some of the key words. Aging population across, as mentioned, chronic diseases, chronic conditions. We will have to shift the care to lower cost settings, but also ultimately to homes. And then digitalization, and colleagues have been spoken about it already, but that really has reached a turning point in healthcare, shifting value from devices to software and services. So these industry trends, in our view, are fundamentally disrupting the health technology, challenging the way we manage product portfolios today and deliver values to our customers and to our end users, providers, clinicians, doctors, nurses, governments, policymakers, consumers. And we do see two major trends, or two major opportunities, I would say, to take notion of. And on one side, we see the industrialization of care, where standardizing and optimizing building blocks of healthcare would really enable health systems to deliver better outcomes at a lower cost. And on the other side, we see the personalization of care, the convergence of professional healthcare and consumer health, businesses where we in Philips have huge experience in on both sides, enabled by data and digitalization, leading to increased self-management, as mentioned, and personalized treatment trends. So these trends reshaping health technology and enable new value propositions, solutions and business models across the health continuum. And we see a very clear need to enable better health, better care at a lower cost. And we really need to start thinking to move from medical products to more offering solutions and services. Yes, we will still be able to deliver a CT scanner to you tomorrow. We will not stop doing that. But increasingly, customers are asking us to come with solutions, financing solutions, consultancy solutions, workflow solutions, managed service solutions. So there's many trends around the solution and services we are at this moment offering as well. On the personal healthcare side, for me, it's funny. I mean, for instance, we have seen ATM machines since early 1970 developing globally. Today, I think we have an ATM machine on every corner of the street. I can today in Vietnam withdraw money from my bank in Singapore, or you can today travel to Europe and withdraw money from your bank account in Vietnam. And the banking system would know exactly how much money you have on your account. They can track your financial status to the dot behind the comma. Since early 2000, we have Facebook, and we can track each other from minute to minute. I can see where you have been last weekend. Yeah, who have you been having dinner with last night? Where you went on holiday? All these, I would say, IT solutions we have across so many aspects. But yet, if I would collapse today here on stage, nobody could see what kind of medical history I have. Nobody could see my medical history, even my blood type. So we are not there yet. So what is keeping us? And I think the world is indeed facing a global health challenge, and there are significant population trends, growing and aging population, the rise of chronic diseases that add pressure on our resources as said. And on top of this, I think that the systems today are already very much stressed. So the main question we want to address is, how can connected care help address this global health challenge? And for that, we have recently launched the Future Health Index. And the Future Health Index focuses on three important factors necessarily, in our view, to move toward a more integrated system of healthcare. Access to healthcare, integration of the current health system, and adoption of connected health technology for both devices and services. The study, which we will going to run every year, was conducted in partnership with an independent global market research firm in the last few months. More than 2,500 healthcare professionals has been interviewed. Over 25,000 patients have been questioned in more than 13 countries across the globe. And in Asia, we have done the study in Australia, China, and in Singapore. And some of the highlights of three major findings of this Future Health Index are that the first is healthcare professionals in emerging economies are more likely to believe in the importance of connected care than developed markets. Secondly, half of the healthcare professionals and the patients we've interviewed believe that connected care technology would increase the cost of healthcare overall. And around half think that our health system bureaucracy will be a major stumbling block. But on a positive note, most people, patients and healthcare professionals do believe that better integrated health system is the answer to, in fact, better care. And with these insights, we can now be more prepared to cope with long-term health challenges, to achieve better healthcare outcomes for patients and the healthcare system as a whole. With that, I lastly would like to share with you two examples on how we are bringing new technologies to Southeast Asia. And the first example is an example from Indonesia, where we, together with the Indonesian Ministry of Health, are looking at maternal and fetal mortality rates. These rates are very high in Indonesia, around 190 per 100,000 births. And the Indonesian government is very keen to bring that down to around 100 per 100,000 births. And Philips developed a scalable telehealth platform that can be adapted to suit specific rural but also urban needs. And we do that by using a very simple mobile phone application. And within the first 3 months of the pilot we conducted in a small puskesmas in Indonesia, introducing this mobile platform, the pilot project identified that 82 out of the 656 expected mothers would be high-risk pregnancies, a triple in detection of versus a normal situation. Doctors identified the mothers through the data collected from the app, collected by midwives in this puskesmas. In the whole pilot, you will be pleased to know that there were 0 deaths during the pilot, as said. So that is one side of the spectrum. And on the other side, I would like to show you an example from Singapore, where in Singapore, the government sees a need to develop innovative care as a model for heart failure patients. This to, first of all, improve, of course, the patient's quality of life, to provide early detection and clinical intervention, but also very importantly, of course, to reduce long-term care costs. So together with our clinical experts from the USA in Baltimore, researchers from Eindhoven in the Netherlands, developers and content leaders from Bangalore, our global design team, and of course Changi General Hospital, we developed a home healthcare program for heart failure patients. It features telemonitoring capabilities connected to excellent cardiology care from Changi Hospital, supported by tailored patient education and engagement modules. And this is where we see where connected care implementation can indeed improve the lives of many people and also of many chronic disease. So I hope by this you are convinced that Philips will continue to deliver innovation that matter to all of us. We will continue to leverage our strength through our global footprint. We will do that with our outstanding innovation capabilities, utilizing deep knowledge of our customers. We will continue to lift on our very strong brand, and we will do this also with value-adding partnerships, of which many are here in Ho Chi Minh during the HMA today and yesterday. And of course, we will do that with many of our talented and engaged people who would really love to see you during the rest of the day to further discuss how we, together, can build a better, a faster, and a cheaper healthcare model that will support the challenges we are facing in our region. Thank you. Come on.
Thank you, Mr. Johan Vooren. Please sit beside me.
I will.
Well, we still have time. If any questions, please raise your hand. Yes, one. Please, lady, get the mic.
Dr. Castillo from the Philippines. Recently, the WHO praised the Cuban healthcare system as one of the models for the world. We all know very well that Cuba has had economic sanctions for the longest time. And yet now we're seeing that they're coming out with very good clinical outcomes, also based on research and development that is comparable to developed countries. My question is, because it is preventive medicine focused and that the human resource capital has been brought to a certain degree of passion for their people, that sometimes I think that when we have all of this technology, our healthcare providers get so very distracted and the passion is gone. They're so distracted by the technology that is available. My question now is, what can be the presence of technology in the model that Cuba has? I don't even know how much presence of digital technology there is in Cuba right now. It has become so attractive, particularly for a country like the Philippines, so much so that the Secretary of Health and her team was sent by our new president, not to the US, not to the West, not to the Singapore, but to Cuba.
Yes, please.
Yeah, thank you for the question. As you have mentioned, I've been working in 3 continents in your lovely introduction. Unfortunately, Cuba or Latin America was not part of that. So I wouldn't know about the Cuba system, but I do know that we will look at healthcare systems across the world. In fact, the whole Changi pilot we have done is also based on the fact that we have for many decades already have a huge amount of history in how we manage, for instance, telehealth in the USA. 15% in the USA is using our EICU telehealth solution. And we take out a lot of experience from, for instance, the USA model. Now, USA is not Cuba, and Cuba is not Philippines, and Philippines is not Singapore, but we can learn from each other. We also have many pilots running in Holland, where we also look at innovation around IT solution in both homes and in both hospitals. I can assure you the passion is there. Yeah, so for myself, I do have enormous amount of passion for this business. We could also hear from our speakers today that they're also very much passionate about the business. So I think the passion is still very much there. And I think that the IT solutions can only complement us to do our work better, to do our work faster, and to have a better clinical outcome. But the passion, in my view, will still remain.
Any other question? We still have, yes, sir, please.
I'm Phúc from Flinders University, South Australia. My question regarding the closing the gap between the rural and remote areas and the central healthcare system. So how could the technology companies, as a Philip, the company technology provider, could support the progress of closing the gap between the central and rural areas healthcare system? Thank you.
Thank you. Also a very good question and not an easy one. So we do also see the need, specifically in South Asia, to focus much more on primary care. And primary care, of course, something we need in rural areas. But I do think that we have the opportunity to somehow leapfrog the system. As mentioned, we have a young population. As mentioned, we have a huge internet penetration. We have a huge mobile phone penetration. And for instance, that enabled us to bring this solution to a very small puskesmas, a very small village in a rural area of Indonesia. In my view, it's not so complex. We can bring simple solutions. The Indonesia example is just a very small backpack with a blood pressure meter, a temperature meter, oxygen meter, and there's a small app, and the app is just asking some very simple questions to the mother-to-be with regards to how do you feel, did you incur any problems in your first semester or second semester? No. Is there a history in your family? So education is there as well. Education. So it is doable, but we need a lot of support also from the Minister of Health from those countries to really start implementing these models across the country. So we have the systems in place, but we also need to execute together with government units to make this really happening. Thank you.
Any question? Maybe the last question? Yes. Please, sir.
My name is Conrad Pereras from the Philippines, and I represent St. Dominic Medical Center. My question is, at the turn of the century, a lot of people have been talking about the wellness revolution as opposed to the healthcare revolution, meaning the sickness industry and the wellness industry. And it looks like there has been a growing divide between these two. And since we're talking here of hospitals concerned about the sickness industry and the advent of technology, do you see your company spending resources on that area of well people as opposed to just focusing on the sick people?
Thank you very much for this question. Yes, I truly believe that Philips is doing that. I mean, we have a huge history where it comes to what we used to call consumer lifestyle, consumer products. We have a huge history in health systems. So over 100 years, we work over those two elements. And what I've talked about is about the convergence of that consumer lifestyle with healthcare, and those two are just exactly fitting now in the core strategy of Philips. And I think it's very funny what you're saying, because I look at it at that view as well. So we called ourselves health systems for so many years, but are we really health systems? I think we are not really caring about the health; we are caring about the sick. So it's more sick care than health care, and I think that is what we need now to expand. So if you look at the strategy for Philips, where we look at the total continuum of health, we look at healthy living. And healthy living can also be simple. It can be as simple as an air purifier or an air fryer or anything which provide a more healthier living. Prevention is the same. It can be a simple toothbrush. It can be wearables, which we are now at this moment in Berlin in IFA are launching. By the way, the first health watch which has an FDA approval. So we are really focusing on those two elements in our strategy, healthy living and prevention, to really make that link to diagnosis, treatment, and home care. So we are very much embracing the two together, and we do make investments on both elements, significant investments. And I think the majority of the investments you see in Philips today are in fact in that prevention space, are in connected care technologies, are in prevention and bridging that with healthcare. So yes, we are investing, and yes, we do believe that those two need to be brought closer together to make it work.
Yeah, before I close this session, just one asking for you. Regarding, you have mentioned your device regarding to the puskesmas, just a bit to see what is the challenge, find difficulty, or what is the trend that you can take a note of this evidence. You have also a healthcare index.
Yeah.
Please.
Yeah, so we do see some challenges by rolling this out. I think one challenge is of course to have a very good connection with the Ministry of Health. Specifically in Indonesia, you have also a decentralized system. So we need to talk with the professors, and we are really trying to engage with them. So again, as earlier mentioned to the other question as well, we have the solution at hand, and the solution is not so complex. But we really need to work very close together with the government units, in specifically Indonesia in this case, but we also have different examples, to really make this happen.
Okay, thank you.